Hello, this is Barnard Crespi at Datatel, and with me I have
Jonathan Riech here, the healthcare solution consultant at Global Payments.
excellent. So today we're going to be talking about the impact of the Canada Post strike on healthcare providers and how that's impacted their ability to communicate with patients, specifically in the area of finances and payments. And we'll be talking about how we see this unfolding and how we may be able to help in terms of bridging that gap and how important it is to bridge that gap in a time when hospitals are unable to communicate with patients. So, uh, Jonathan, any thoughts on this?
Yeah, absolutely. This is something that we've heard time and time again, and it's actually our clients that came to us asking for solutions. Right? They had these digital solutions in place to remind patients, and they came to us and said, "How can we repurpose this?" And so we worked collaboratively with our clients to build out more of the solution in terms of how we can be more proactive in addressing, notifying, and reminding patients about their bills. So please, Bernard.
Yeah, so look, I mean, you're absolutely right. You know, hospitals who have had solutions not necessarily designed to deal with the Canada Post strike have gotten very creative about repurposing existing technology that's available to them to bridge this gap in terms of communication with patients. But some of the biggest issues, which are I found, you know, and I've been at this for many years, uh, besides the fact that it's a significant what's happening right now, it's a significant impact to their cash flow because they do depend on patient payments to bridge the gap.
Absolutely.
And we have heard in some communities, you know, cash from patients accounts for probably over 15 to 20% of their budget. But what we also need to remember is that in Canada, over 80% of invoice and statements that healthcare providers generate for things such as small as an ambulance bill or crutches or whatever these incidental services in fact mailed to patients in a paper statement. And to add to that, the whole process of reminding patients, because we do have there's a lot of delinquency in the healthcare payment side that that whole follow-up process also relies on paper. So the Canada Post strike is significantly impacting um, hospitals across the country in terms of their ability to, you know, maintain those cash flow coming into the hospitals. Now, Jonathan, I know you're talking about some hospitals that you've seen repurposing. You've talked with a lot of hospitals who are starting to really look at how they can enable this in a quick way to bridge that gap. I mean, what are you seeing?
Yeah, absolutely. So paper statements is definitely one of the main usage that we're seeing right now to remind patients about their bills, notify them that the bill is coming, or just showing them their bill. This is often a paper statement. So what we're seeing through a digital means now is that there's so many different ways to leverage it, right? You can do a soft reminder. You could just do a notification. You can, instead of going by email, sending out, oh, by the way, we're being impacted by the Canada Post strike, you can send a text message, a voicemail notification now, right? So there's so many different ways in which these digital reminders that are so more effective, because with the new generation these days, they're looking at their cell phone. They're not necessarily always reading their emails. I myself, sometimes I read the first line of my email. I'm like, if it doesn't say something important in the first line, next. And I'm sure that's the case with many clinicians, the admins of staff within the organizations in the healthcare space. They're overwhelmed, right? It needs to be quick. Same thing with patients. They need to be quickly notified in an efficient manner. And digital reminders is an excellent way to make that happen.
Yes, and as we've mentioned, I mean, there's been a handful of hospitals in throughout the different provinces who have adopted automated payment and let's call them payment notifications and payment reminders as part of their standard operating procedure of accounts receivables. And I mean, we've seen some of the major hospitals have been doing this for several years already. Um, there's obviously some that have come on board in more recent, call it years, still not significant enough. Uh, the For those who have implemented those processes and that technology, They are utilizing repurposing. That was the beginning of the conversation. They've started to repurpose this in a short order to bridge that gap until such time as Canada Post becomes, comes back online.
It's a
And
massive problem.
and what we're hearing, some of the things that we're hearing from some mailing experts. I'm not a mailing expert, but what we actually had the conversations that the queues are going to take on probably weeks in order for these queues to take, to catch up once the strike is over. Also, that's going to have impact on the hospitals. So the hospitals have to start, and healthcare providers have to start doing something today to bridge that gap, because otherwise that cash flow could not come for another 4 to 6 weeks. And this is critical cash flow
Absolutely.
that the organizations need in order to maintain, healthy operations.
That's an excellent point. I mean, the backlog that's going to happen out of this, whether it's resolved this week, next week in a very timely manner, let's say best case scenario. I mean, backlogs are a real problem. I myself have a personal instance with this where I ordered a Christmas gift and it's actually completely delayed until January 20th is the expected arrival date. And I ordered that before December 1st to give you an idea. So imagine the backlogs. And we're seeing these hospital organizations, it's a 30, 60, and 90 days in order to collect, which means that if they don't implement some solutions to readdress this issue of reminding the patients of their bills, typically we see right about on the 2 or 3rd reminder is when they actually pay their bill. If there's none of this reminding that's going on anymore, we're looking at potentially a 3 to 5, maybe even 6 month delay onto that cash flow that you're talking about here, Bernard,
Yeah.
which is a
Well,
massive, massive problem for the healthcare space that are already in huge deficits. So something definitely we need to address right now with
yeah.
these digital reminders.
I know that you have been a very big proponent of future proofing and automation, or automation to future proof, and this is case in point. This is future proofing that should have actually happened, call it years ago. Unfortunately, now we're playing catch up, trying to the silver lining is that organizations, as they're starting to adopt this, and they will over the next few weeks, they'll realize that this is part of going to have to become part of standard operating procedure for how they communicate with patients, whether it be because of a mail strike or any other type of situation
Yeah,
that
staff
may
gets
impede
sick.
them
Yeah,
to practice, call it their traditional legacy type of communication, because that's really what's happening is we depended so much on legacy communication, and now it's being impacted. um, and hopefully some leaders do wake up and start seeing, it's time to act now. Now again, we've seen hospitals who have been, and we've had, like, in the last week alone, we had four of our customers who already had payment and reminders, starting to, like you said, retool what they already had, because it was not a very big jump to actually go and retool their processes as well. I mean, there's going to be a heavier dependency on their a billing team being available to answer questions, because some of these reminders that are going out, it says, look, there's because of the Canada Post strike, we were unable to send you a statement. However, this is your account, this is the amount that you owe, but if you have questions around us, you know um, you can call our billing team from Monday through Friday, 9 to 5. And obviously, some of our other customers, we have customers leveraging some other digital technology on payment side that's going to enable them to manage this better. But obviously, those who have the tech are using it in very smart ways to bridge this gap through the Canada Post strike.
absolutely. Yeah, and they're future proofing their organization to another level, right? It's just about having the same process or same thinking as having online payments available, right? Having versatile payment options, whether patients can pay in person or online. You're offering versatility, right? Making sure that the patients can pay whenever they need to pay. Same thing comes to reminders, right? If you can't remind them, for instances like we're talking about here, Canada Post being on strike, or for instance, like let's say maybe downstream, maybe a staff gets sick or another process, something else happens, and that process just ends there, like we're experiencing now. Having versatile reminder options is a great way to address that and make sure that you're future proofing, but also become scalable, right? Maybe the paper statements is not a really scalable option either, depending on your population and
You're
demographics, right? And so
You're
there's so
right.
many different verticals with this
You,
as
you,
well that you
you,
can go ahead and
yeah, you're
improve.
absolutely right. I mean, as Canada continues to grow, we've seen massive growth. This becomes a very strategic tool to finance teams of the different hospitals and healthcare providers to manage that growth in terms of communication, because that collection process there's not more resources to actually collect, yet
Yeah.
there are there's an exponential growth in terms of the number of patients. Uh, what I think short term, we talking about short term goals, because
Yeah.
the reality is, it would have been nice to have this conversation 6 months ago, and and you and I have been having these conversations for several years already with hospitals. Uh, Hospitals, the way that we've actually looked at this is most hospitals in Canada are operating in three big systems, meaning healthcare information systems, and Meditech, Epic, and Cerner. And the interesting thing about it is that all of them and because we work with all of them, they all have the capability of holding the information that the hospitals need in order to initiate this type of communication. So
Absolutely.
without massive undertaking of technology integration, just good old manual way of downloading information of patients that owe money to the hospitals, and that same information can actually be used through these communication, call them more digital communication systems, through voice and automated voice and text, to initiate and bridge that gap during the Canada post strike. And that's what we're actually seeing. Is we're seeing we have some hospitals that have automated end to end, but we also have hospitals that they're still relying on partial manual process, meaning going into their Epic, not Epic, but into their Meditech system or their Cerner system, downloading a list of patients with phone numbers, account numbers, and amounts, and loading that into an automated payment reminder system like the one that we offer jointly, and make initiating those calls. And we were talking to a hospital earlier in the week who's just added another 100 contacts a day, because that's the impact of the on net new invoices to them, is that they cannot communicate with 100 net new patients that they have to invoice every single day. So and that's a mid-sized hospital. That was not even one of the large hospitals, right? But what they were able to do, like going back to the Meditech, Epic, and Cerner, who are predominant HIS systems, is that they were able to again create new communication, call it templates, to deal specifically with the Canada Post strike, and export data, plug it in, and start to run it. So it's a combination. They are becoming incredibly resourceful. Of course, this is a time to really start implementing this type of technology. And I know that, like you said before to me, things do move very slowly in this space. Um, but there is now an active reason as to why to actually look at this as part of standard operating procedure.
Yeah, absolutely. And although the healthcare space can work very slowly, when there is a need like this in order to save the cash flow and make sure that everybody's being reminded accordingly, things can act very quickly as well, right? With cycle, it's
Right,
yeah,
right. Yeah, we
it can
actually
act
saw
very
we saw that. We saw that in
yeah,
the last couple of weeks. We've never seen decisions being made so quickly around, we have to do this.
yep,
On the average hospital right now, we've been able to implement this in 3 to 4 days. Because again, like you were talking about the delays, your Christmas gift not arriving into mid-January, late January. I mean, that means they need to start acting today in order for those statements, where over 80% of them are paper, right?
yep,
And I'm going to guess that it's even more than 80%,
easily,
because I still don't see any email statements going out. Uh, but now we need to bridge that gap on the short term.
yeah, no,
And I guess, what I want to sort of is an opportunity to make a statement around this and say, we can help the hospitals the same way as we've helped many of our existing customers through this time. We are open here to work with you potential, hospitals who want to adopt us.
yeah, no, absolutely. And digital reminders are so versatile, as I mentioned previously. You can use them in so many different ways. For soft reminders, hard reminders, you can work it in conjunction with sending paper statements nonetheless, even once Canada Post gets resolved. So it can really work into the whole strategic plan of the hospital, as we're seeing it for other organizations, and is especially with what you mentioned here, Bernard, where there's data exchange that can happen between all these main HISs, that being Epic, Cerner, and Meditech, where data can just be pulled and that can be automatically sent out as it's
Well,
finished.
that is the goal. The goal would be full automation. The
Yeah.
reality is in short term, because we have to be pragmatic, that we have
Yep.
a short, this window now needs to be addressed. It can still be done without having to do too much IT heavy lifting. That can, it has a very, I'm going to call it small IT footprint for this short-term implementations that are required in order to bridge this gap during the Canada Post strike.
Yep.
So, Jonathan, I think we've covered everything today that it would be for our audience. I think that, they become aware of what's happening, what the possibilities are, what the
Yep.
opportunities are.
I
I
think what
know
sums
that
it up
this,
best. I think what sums it up best, to be quite frank with you, Bernard, it's where you're able to reduce costs by over 60% to remind patients, as well as future-proof the organization, address this issue with Canada Post within 3 to 4 days of that implementation period. So it's
yeah,
something that can be
I know,
very
I know
cost.
it sounds, is that possible? But the answer is that it is possible when we all put our heads to it and we have the motivation
Yep.
to improve the delivery of, healthcare. Because at the end of the day, when we're thinking is I always look at this is critical because it is a way, cash flow does fund our healthcare system.
Yep.
And this is money that's not going into the hospitals right now. So we collectively we have set up a task force specifically to work with hospitals through these challenging times that hopefully it will be over soon. But in the meantime, we're ready and prepared to lend our hand and assist.
Yeah,
So,
absolutely.
uh, any
So if
last thoughts, Jonathan?
Yeah, absolutely. So if your organization is suffering from the Canada Post strikes right now, just feel free to reach out and we can probably help you within 3 to 4 days and have a solution in place. So something to keep in mind. We look forward to working potentially with your organizations as well.
Thank you, Jonathan. And
Thanks, Bernard.
again, this is Barnard Crespi at Datatel signing off for the day. Thank you for listening, and until the next time.
Thank you. Bye bye now.